So I know, thank you to all of you for a great presentation, and also each of you have monitored the chat box as well and built in some of your comments to the questions that were coming up. As you saw, many questions about face masks, about greeting, all the things we covered today. And I think to reiterate, and I think you've seen from the panel, people have different approaches, but they're still within the guidelines. It really is an issue of judgment. And I'll reiterate what Brian said, your inspector is there to help you. If you have a question, call, reach out to them and ask them. Someone mentioned in the chat box, can they call the inspector to come out and check them out before they open? I think from what Brian said, there's going to be an effort to go out and visit every program within the next 36 days. But I would say, again, if you have a question, call. Probably one of the bigger questions I saw that came up in different ways is the issue around other people in the center. So lots of questions about what the director can and cannot do. Can the director step in a class if a teacher has to step out? And I think that was answered. But there were questions about programs that are mixed, that provide an after-school program, early Head Start and Head Start, or bringing outside people in, like therapists, occupational therapists, speech therapists. Are there limitations on that? And I guess Brian is the place to start.
You know, there are two buttons to talk, and I keep forgetting to hit the both of them at the same time, so I apologize. So the health and safety guidelines are pretty clear on this point, and we know it is a particularly difficult thing to work around for a lot of programs. Outside visitors are not permitted to come in and out of the center, and that explicitly includes outside therapists. Some programs do have internal therapists. A lot of Head Start programs do have those folks on staff, and that's an integral part of the program that's being offered. In those cases, we need to make sure they're abiding by social distancing, that we don't have them directly interacting with kids that would essentially allow them to cross-contaminate groups. We want to make sure that the adults who are directly interacting within that sphere of the 10-child group is strictly limited. But yeah, for outside visitors, whether that be therapists or entertainers, we do have to strictly limit their entry into the center. For those folks who are allowed to enter the center, and there's very few of those, unfortunately, you do also need to make sure they abide by the screening procedures, which means if your licensing inspector, for example, needs to come in to visit the center, they need to have their temperature taken and their symptoms checked before they can be admitted to.
Okay, thank you. Keisha, Nicole, anything to add to that from your experience?
I currently don't allow anyone in the building other than parents, one family at a time. Per the guidelines, I did post a sign on both of my entry doors to that fact that only essential personnel are allowed into the building. That means teachers and one family at a time. So right now that's running very smoothly. If I have anything that has to be done, an emergency, a repair, that's done on the weekend. And then everything is sanitized prior to reopening on Monday. As far as tours, right now we're not doing any tours. We've got to figure out how to get around that. We're exploring the possibility of maybe a virtual tour or after hours tours.
Great, thank you, Keisha. Nicole, anything to add?
Currently it's strictly, since this started, our staff and the children. Nobody else is allowed. Even if we're interviewing, it's via over the phone pretty much. We've been very strict, and we'll probably, even if these things get lifted, we will probably continue as long as we can, not letting parents back in the building right away. I think it's helped very much with the health and safety of the children, and keeping the center even more, because if you allow the parents back in, more things are going to be touched. So I think it's a great rule, and we've had no problems or issues with that at all.
Great, thank you. A couple of questions came up around groups of children who do not attend all week. So one question, and similar to a number of others that came up, can we have a group of children attend 2 times a week and then a separate set of children attend 3 times a week? Or does it need to be the same 10 children all the time? I know, Brian, I guess we'll start with you again.
So, and the answer, and this feels like a cop-out, but the answer really is do your best. We know that the circumstances of each center are going to be different. We are not prohibiting part-time care. We understand there are some children who will be in and out, and some flexibility is necessary to allow these groupings to occur. We, again, looking for a good faith effort to minimize the mixing between groups, mixing of staff between those groups. And then obviously you need to adjust to reality, which in some cases will mean that there are groups that do have some degree of commingling occurring. And that's just an unavoidable risk, unfortunately.
Great. Thank you. Well, I see we're almost up at 2 o'clock. So let me just close with a couple of housekeeping things. And I would like to do one more poll question. As I said at the beginning, we knew we couldn't get to every question, but this has been recorded. It will be available on our website and sent out to you. We are assembling a frequently asked questions sheet, trying to address the questions you've raised. Patricia on our staff has been putting up the guidelines. As you've been asking questions, it's very important to look at those guidelines. So again, we'll get back to you with that information. Other questions came up. There's a number of questions about liability. What if someone gets sick at the center? What is a staff person? What is the liability? And I think that's an issue that it seems like every state is grappling with now. That's not one that I don't think ACNJ has an answer to today, but we'll follow up on. And then a series of questions about employment, which leads into our webinar on Thursday. Our final webinar will be Thursday at 1, and it will talk about those issues of employment and unemployment. What if you ask staff to come back who don't come back? So we're arranging that, and we'll have more information out about that webinar shortly. But before we sign off, I'm going to ask Catherine to post our last 2 poll questions. Very helpful to hear from you as well. So Catherine? First one of the last 2 are, if you are currently closed, do you plan to reopen? Yes, on June 15th. Yes, sometime in the summer. Yes, in September. No, or I don't know. Again, for those of you on the Zoom call, you can answer right on the screen and submit it. If you're on Facebook, you can put your answers in the comment section on Facebook. Again, if your center is currently closed, do you plan to reopen? Yes, on June 15th. Yes, sometime in the summer. Yes, in September. No, or I don't know. So the majority of you on the call, 45% said yes, you plan to open sometime in September, 22% next Monday, another 22% in September, and 11% are still on the fence about that. Helpful to know as we look toward, I think we all have questions about what happens when childcare reopens. And final question is, what are your major concerns about reopening your program? Implementing new operations, hygiene and sanitation to prevent the spread of COVID, staffing, physical distancing, not enough children enrolled, inadequate funds to stay open, or other. This is a question that you can check more than one. So it's not one to the exclusion of others. Check anything that applies. Again, what are your major concerns about reopening, implementing the new operations, hygiene and sanitation, staffing, physical distancing, not enough children enrolled, inadequate funds to stay open, or other? Unfortunately, you can't write in the other, but you can check off any of these that apply. And again, for those of you on Facebook, hard for you to do this, but I'll read the list one more time. And if you can identify what is of greatest concern to you. Implementing new operations, hygiene and sanitation, staffing, physical distancing, not enough children enrolled, inadequate funds to stay open, or other. So the top issue for those of you who replied to the Zoom poll was physical distancing. 57% of you were worried about that, followed by implementing the new guidelines. Actually, pretty much all of the above. And I hope actually that this conversation has helped to address some of those questions. I think I'd reiterate what the panel said, that there are different approaches as long as you stay within the guidelines. A lot of it is judgment and doing what works for your program. And I would just close by saying, this webinar, like the one we did on Friday, has brought out, I think, an impressive group of childcare professionals who are making difficult decisions in a difficult time, who are committed to serving children, and who are a wonderful resource to each other. Very nice to see in the chat box people responding to questions as well. So thank you for joining us. Thank you, Keisha, Nicole, and Brian for joining our panel. And Beverly, thank you for organizing and facilitating the panel. We hope that this has been a benefit to you. Again, we'll have the recorded version and frequently asked questions out to you and also on our website. Thank you all, and join us on Thursday, 1 o'clock, on employment and unemployment issues. We'll get that notice out with more detail as soon as possible. Thanks, everyone.